Hi, I'm Jennifer Kranjak, and I am an online hypnosis practitioner helping people in the surgical, medical, and healthcare communities live happier, healthier lives. Today, we're finding a lot of people in the healthcare world are actually quitting their jobs. And if you are in the healthcare community, you know what the reasons are. You've probably experienced many of these things. And the list actually can be quite long for the reasons why people are leaving the medical, surgical, healthcare community. And that is just because it is a very thankless job, basically. It's very rare that there's the appreciation that you're hearing from the public when you are giving everything you have, you're using your knowledge, your skills, and you're caring enough to come out with the absolute best that you have to offer. And it's not even noticed, it's more of an expectation of other people that you just do this for them. And it can really play a huge part of diminishing mental health when you are not noticed, acknowledged, and appreciated for who you are. A lot of the time we hear people in this healthcare community saying things like, I feel like I work on an assembly line. People are coming and going, and it starts to get overwhelming, and there is no change. There's nothing new that's coming in. It's just situation after situation, even dealing with people who are coming in and abusing you, telling you that they know what their problem is because they googled it and they're the expert, and you just give me but the drugs that I tell you to give me, and you treat me the way I need to be treated and send me for the tests that I'm demanding because I saw that on the internet. And that can also add a lot of stress to somebody when you know that there's a deeper problem, because you only have so much control over other people's lives. And that also plays into the fact when you're seeing somebody who's in a critical condition where their illness is, making them terminally ill, they're going to die, or they are dying, something tragic has happened, a terrible accident, and there's only so much you can do, and it leaves you feeling helpless. Then you have the politics behind all of the medical area, and especially depending on where you are in the world, what that looks like. So you might be dealing with insurance companies that are putting a full stop on medications that you need for a patient because their health requires it, but they want you to do something different, and you have to play this game, and you feel that you are not serving your patient appropriately. You feel that it's detrimental to their health, but you have no choice, and you're playing this game that is being asked of you, and you have no control over it. And you can see that your patient is actually going to be declining in health, or it could be a critical situation because you can't get the help that you need because of all this red tape. And it just wears you down. It's exhausting. You're going home stressed out. You feel anxiety. You're not sleeping. You're sacrificing everything that's personal to you in order to work extremely long hours. And it wears you down. The burnout is overwhelming. And this is why a lot of people are quitting. And I've heard over and over again by people in this healthcare community saying, I went into this because it's a passion. I feel like I have a special, almost soulful connection to the people that I'm treating, especially if it's surgery. There's a real spiritual type of connection there. And you feel like you are a part of something bigger than who you are. You're helping humanity, you're helping people, and you're helping families. And it was meant to make you feel good about giving of yourself. But in turn, it's gone south, and it's not going the way you had always hoped it was, because it's sucking the life out of you, and you're finding that you're low energy, you're low motivation, and you're being asked to do things and give medication with split second decision, and you might make an error and you're afraid of the consequences of that error, and that builds and it builds and it builds, and you end up having all of these side effects again, like that insomnia, the depression, the anxiety, the panic attacks, the loneliness. You're just wanting to be left alone. You feel like you are losing a connection with your own humanity because you're not even interested in the interactions with other people anymore, because you just don't feel like you have anything left to give. You're living in your head, and what is being said inside your head is not helping, because the negative thought loops start going round and round and round. Now, if you feel like you are somebody who is going through this, you will know that if you continue on this path of feeling this way, feeling like you want to quit, but you keep getting out of bed against your own will just to go to work, down the road, it's going to get much worse. And what's that going to look like? Thoughts of self-harm, thoughts of even beginning an addiction. Maybe you already are dabbling in maybe a bit of alcohol. Maybe you're smoking more than you used to. Maybe you're taking riskier behavior. Maybe you're thinking of doing something that you shouldn't be. And it's because of the side effects of these feelings. You start not caring about yourself. Maybe your own self-care is even plummeting. Maybe you don't even care if you get up and have a shower in the morning. Maybe you're just too tired. Maybe you don't care what you look like, or you don't take the pride anymore. Maybe you're tired of the competitive edge, or acting like that perfect doctor or surgeon or anesthesiologist that you want to present to your patients, because that's what they're expecting you to look like. They want you to be interested in them when you feel like you don't really want to care anymore. And it's going to get worse. And so down the road, you can see how this is going to affect your life. It's going to affect your home life, your family. Your children are going to pick up on it. Your spouse or your partner is going to pick up on this. You might not be giving it your all in those relationships anymore. They're going to decline. It could end in divorce, separation. A lot of things can happen. And if you quit the job that you went into because it was a passion at the beginning, then what are you going to do next? That's the question, because you're very specifically trained in something that took many years to get you to that point. Now what's going to happen? Like, do you retire? Do you find another job? What do you do? This is the question. So you know that you have a stable income now. It's hard to give it up because it meant so much. And moving on to something new can be scary. And it could be sad. It can actually be breaking your heart by leaving the industry. And you are just literally at this crossroads of what to do next. If staying in the job that you want to stay in is truly important to you because you want to feel those feelings that you had when you first got accepted into school and you were ready to take on the world and you had something to offer and you want to feel like that again, now is the time to start thinking about what you can do to help maintain that or bring that back even. So there are many therapy services out there that are out there to help you specifically overcome these personal traumas. And that's what they are. You might even be experiencing PTSD from some of the traumas that you've even witnessed with your patients. And I offer a service that is a therapeutic hypnosis service. I am a complementary therapy, which means I can work in conjunction with traditional therapy. And I deal with things like addictions, coping mechanisms, anxiety, stress, everything around emotion. So if you are feeling like you're fumbling, you feel like you can't sleep, you feel like you're sinking, the style of hypnosis that I use is very cutting edge, and not many people are doing it because it is very, very new, and it's high impact results. And it can happen very, very fast. It can actually happen in as little as one session to start new neurology taking place in your brain to help you have new automatic responses. So we take those spiking levels that you're feeling of depression, the pain, the anxiety, the cravings, if you're having addiction problems, and bring them down, and maybe even eliminate them altogether. And the neurology will continue to change throughout the course of your life. So you're having natural automatic responses that you don't even have to think about, because we're allowing the mind to fix the problem, find solutions and resources you didn't know you even had in you, so that you can cope and find that joy that you used to have in the job that you were working in the healthcare community. If this sounds like something you would like to actually explore more, I have free consultations online over Zoom. All of my sessions are actually online over Zoom so that you can remain at home in privacy. And this is not on the traditional therapy records. So your licenses are safe. You can have the treatment that you like to actually make you feel better, more rejuvenated, and be healthier and happier mentally and physically. So again, I have a website. If you would like more information, there's more videos there and there's more written content, I should say. If you would like to explore that, I also have a lot of videos on YouTube that if you would like to watch more and learn more about what I do and how I do what I do and the hypnosis that I actually perform. Please feel free to take a look at those videos. If you have any questions, please reach out. I am very happy to talk to you and get to know you and learn how I can help. And I hope that you found this informative and helpful. And if you again have any questions, reach out. I'd love to hear from you. And I do wish you a fantastic